Kay Burke has many skills and natural characteristics that make her an exceptional volunteer and an invaluable part of the Bluewater Health team. Kay helps patients and families with information and wayfinding. She does this exceptionally, enabled by her ability to develop relationships with patients and families in a short time. Kay is a very good listener, and the trust she builds gives patients comfort to share their healthcare journey with her. She has a knack for remembering names and details and activities done previously to help them, leading to deeper and more meaningful connections. Patients recognize the genuine compassion she has and her desire to help. She works well with others and adds important input to ensure the task at hand is done completely and with high quality. She has an awareness of the needs of others, looking to improve processes whenever possible to ensure the patient has a supported experience with less stress. She's also interested in expanding her knowledge base to learn more skills. Kay always puts patients first, taking extra time to meet their needs. It is not uncommon to see her helping people during her scheduled breaks. Kay is a dependable asset to the organization and those we care for. Beth Donald is a registered practical nurse who has been a member of the Bluewater Health team for over 40 years. In that time, she has garnered the respect of her patients, families, colleagues, and managers for her strong work ethic and kind, compassionate way. Beth starts each shift with a positive attitude and goes above and beyond for her patients. She makes sure everyone's voice is heard and treats all patients as individuals, receptive to their needs and concerns. She encourages patients and families to participate in their care, even if it takes a little longer. Beth is passionate about being part of Bluewater Health and is devoted to her role as a nurse. She is a go-to resource person for her coworkers. At the same time, she seeks advice from others as needed and is receptive to any suggestions from the interdisciplinary team. Beth loves to share her knowledge. She has served as a student preceptor and is a phenomenal teacher for junior staff, taking every opportunity to help others develop critical thinking skills. Her coworkers say that she's always teaching. She makes sure that at least someone learns something new on every shift, whether it is a life lesson or a nursing skill. She encourages everyone to continually learn and enrich their lives and careers. Susan Harris is passionate about her work supporting people with diabetes and achieving self-management skills to improve their lifelong health. Susan is always smiling and treats her patients with enthusiasm, honesty, and openness. She has a genuine concern for all her patients and their families. She helps them with socioeconomic issues, linking them with community resources that will help meet their needs. Susan values collaboration with her colleagues, appreciating the expertise and viewpoints of the multidisciplinary team. She collaborates to implement new practices to ensure compliance with Bluewater Health core values and national standards in diabetes care and management. She believes in being active in Sarnia-Lambton, establishing relationships with community partners to support people with diabetes in achieving their health goals. She has served as a board member of the Canadian Diabetes Association, representing Southwestern Ontario, and was the lead in her department's successful submission to the Canadian Diabetes Association for their Standards and Recognition Award. She has been a preceptor for dietetic interns, ensuring that their training involves collaboration and goal setting with patients. She is recognized as a dietitian who ensures that students get the best training to meet dietetic professional competencies. During the internship placement, students can see how Susan applies ethical decision-making in the provision of diabetes education and management. She is curious and embraces new practices while willingly paying it forward in offering information to others. As a senior speech-language pathologist, Deb Hooks' goal is first and foremost to implement high-quality speech therapy to every patient at each therapy session. Her commitment to giving the best she has to offer is authentic and humble, placing the patient and their family at the center. Deb has a gentleness in her patient interactions that reduces their fear when a health event has altered their life. She displays a strong commitment to her profession, her team, and Bluewater Health as a whole. She is trusted and well-respected. She collaborates with other disciplines, celebrates professional uniqueness, and acknowledges everyone's perspective to enhance the experience and quality of care for patients and their families. When emotions are high and opinions are varied, Deb is able to focus the team on a patient-centered approach and uses diplomacy in a way others can hear, leading to better relationships and outcomes. Deb finds possibilities when others believe it won't work, painting a vision others can follow. She embraces change by setting the example as an early adopter of new ways of thinking, bringing others along as she goes the extra mile to illustrate a new method. As a person and a professional, there is nothing mediocre about Deb's approach, her relationships, or her clinical practice. She lives life with integrity and honesty and is guided by a strong moral code. Dr. Mohammed is a team player committed to providing exemplary care every time. He interacts and collaborates with all disciplines and utilizes the expertise of others to provide the best possible care. Dr. Mohammed demonstrates a great deal of compassion for our patients through his gentle, calm, and caring manner, positive approach to his work, and his sense of humility and humor. Dr. Mohammed is genuine and respectful in all interactions. He is receptive to patient values and cultural needs when discussing care plans with patients and families. He ensures that they understand the risks and benefits of treatment options and allows time to make important choices. Dr. Mohammed follows safe procedures, policies, and best practices, such as order sets, safety checklists, and appropriate antibiotic use. He is fiscally responsible and only orders necessary tests that are required to assist with diagnosis, treatment decisions, and care strategies. By following booking procedures and rounding on units early to discharge patients ready for home, he contributes to efficiencies, flow, and lightened workload for staff. Dr. Mohammed is thorough and appropriate with investigations and uses data like wait times, benchmarking, block utilization, weight of cases, and mortality and morbidity statistics to improve quality and efficiency of the care he provides. Dr. Robinson is patient-centered, evidence-based, and committed to elevating the delivery of care in the mental health program and our community. His interactions are consistently respectful, and he works without fail to provide quality care by engaging patients, families, and colleagues with honesty, integrity, and clarity. In many situations, patients and families may have had difficulty coping, either because of circumstance, diagnosis, or treatment. Dr. Robinson's demeanor has always remained respectful and courteous to those in crisis. For example, Dr. Robinson agreed to accept care for a complex and challenging case. The experience involved heavy criticism, considerable challenge, and complex issues ranging from safety, housing, and ongoing conflict. With the patient at the center of Dr. Robinson's work, he advocated for the patient to be heard in treatment planning sessions, and despite an evolving plan, the patient made their own choices, which were respected. Dr. Robinson not only maintains knowledge of evidence-based practice, but shares this in the context of his day-to-day interactions with nursing, social work, and other members of the healthcare team. He is a lifelong practitioner, author, presenter, and educator, and has volunteered significant personal time to prepare and instruct a training program to expand the knowledge of the specialized nursing team in mental health. This extraordinary contribution is making a positive difference in optimizing the scope, role, and function of the team. Russ Walker has been a dedicated volunteer on palliative medicine for more than 20 years. Having a close personal tie to the program, he gives of his time and his heart to support patients, families, and staff. Russ distributes ice water when he comes in and does anything else staff ask him to help with. He is respectful and friendly with everyone he encounters. He is quiet and compassionate and has a personal understanding of what patients, families, and partners are going through. Russ has a deep respect for the work and dedication that Bluewater Health provides palliative patients in our community. He has adapted to changes on the palliative unit over the years and embraces new staff as well as the ones he's known for over 2 decades. Russ works well with the team to protect privacy and confidentiality, checking with staff to determine if it's appropriate to enter patients' rooms. Russ has worked hard his whole life and is dedicated to his family. He is an adventurer, a pilot, a sailor, and a world traveler. He motivates those he encounters to stay active and involved. His giving spirit shows that hard work and dedication are possible at every age.